My guest at this time is Grace Marie Turner. She is president of the Galen Institute, which is one of the leading healthcare policy organizations in the country. We've asked her to comment briefly on a couple of headlines related to the ongoing healthcare debate. Of course, it's a major part of the presidential campaign. On the Democratic side, we've got the debate over single payer or public option. And as Grace Marie has explained before, she doesn't see a whole lot of difference other than how soon either of those would end up being single payer. But today we're going to take a look at how well Americans understand the issue, the public in general, as well as what some House Republicans see as a better approach on healthcare policy. And Grace Marie, thanks so much for being with us.
Oh, it's a pleasure, Greg. Thank you.
Well, let's start with what Americans know and don't know about Medicare for All, because the Kaiser Family Foundation asked adults, not necessarily voters, but adults about Medicare for All and found 51% support it, 46% oppose it, which might be eye-raising to some. But then when you get into the details, you might see why it's popular, because 55% of respondents believe that people who get insurance through their jobs would keep those plans, and 55% also believe that people who bought their own insurance would be able to keep those plans. 40% said they thought private insurance would still be the primary way that Americans would get coverage under Medicare for All. 54% said that individuals and employers would continue to pay health insurance premiums. But when folks are informed, 58% oppose Medicare for All once they know that it eliminates private health insurance companies. 60% said they oppose it if it requires Americans to pay more in taxes. And 70% said they would oppose it if they knew it would lead to delays in getting medical tests and treatment. So what do you make of the big disparity here between where people stand and where they stand once they know some of the facts here?
Well, too many people have been told that we're going to give you all of your health care for free. You're not going to owe any premiums. You're not going to have any deductibles. You're not going to have any co-payments. And everything you need is going to be paid for by somebody else. I mean, a lot of people sign up for that until they start to see, as you show, the details of, well, what does that exactly mean when the government takes over our healthcare system? And you sort of have to wonder when people hear Medicare, which of course is not really Medicare, Medicare for all, and they think, well, it doesn't mean me. And I think, let's think this through, folks. It does mean you, and it does mean the elimination of all private insurance, whether it's employer-based health insurance or plans that people own themselves. Medicare itself would go away, and Medicare recipients would be competing with everybody else for a much more limited supply of doctors. I spoke with a physicians group last Friday, and they were not aware that this plan would mean at least a 30% cut in payments to physicians. And they said, none of us could sustain that. Our offices would close. And so this pie-in-the-sky ideas, but when people start to, I hope, see the details, they'll realize this system just can't work.
So, Grace Marie, as we know, the Democrats control the House, which means the Republican agenda is pretty much on hold in the House of Representatives until whenever they are back in the majority. But that doesn't mean there's not ideas being thrown out there. And the Republican Study Committee, which is essentially House conservatives, throwing out some ideas here. Number one, delinking health savings accounts from high-deductible health plans so that more Americans are eligible to open an HSA, allowing individuals to use their health savings account money to pay for their premiums if they so choose, or over-the-counter medications, not just paying doctor bills or prescription bills. Also increasing the size of HSAs up to $9,000 for individuals, $18,000 for families. And they also like things like association health plans and some of these other acronyms, health reimbursement arrangements, short-term limited duration insurance. What do you make in general of the mindset of the House Republicans here?
Actually, I think it's really wonderful. They have offered a new generation of health reform, basically saying there's not a silver bullet here. We need to address specific problems and specific issues with targeted solutions, and that's what they've done here. I don't agree with everything, but their basic approach is to say, let's devolve power down to states and ultimately individuals to have more control over the decisions about both their care and their coverage. Let's get the federal government out of the business of trying to micromanage our health sector and put states and communities back in charge and get more energy into the market so that people have more choices, so care and coverage can be more affordable. Their plan follows closely the Healthcare Choices Plan that our Health Policy Consensus Group has been working on for the last year. And it has been shown to reduce premiums by at least 30% and to keep coverage numbers at least equal, maybe higher, because you're going to have more competition, lower cost, and more people will be able to afford coverage if it costs less than it does today. The Kaiser Family Foundation recently said that the average family policy for somebody who has coverage through their job is $20,000 a year. At this point, it's getting to the point that a person's health insurance, whether they're paying the premiums directly or indirectly because of subtractions from their salary, is costing more than their mortgage payment. So we've got to get the market working. Price controls will not work, and that is the solution of Medicare for All. We believe that consumer choice and an energized market to provide the kinds of options that people want is the right solution, and that's really what the Republican Study Committee's plan is built around.
We're talking with Grace Marie Turner of the Galen Foundation. And Grace Marie, the public didn't like it when the Democrats passed Obamacare. They didn't like it when Republicans addressed Obamacare. I won't say tried to repeal, because I'm not sure you could necessarily call it that, although they did want to repeal some major provisions of it. And ultimately, they did effectively repeal the individual mandate through the tax reform bill. But we can often get lost in the policy weeds here. And those pushing Medicare for All have come up with the phrase Medicare for All. That kind of fits on the bumper sticker. How do you distill what conservatives, what Republicans want to do if given the chance after the next election or whenever?
Well, actually, their hashtag, I thought, captured it pretty well. Their Twitter hashtag is Healthcare for You, with the number 4 and the letter U. So I thought that was pretty good as a way of answering and really concisely explaining that we don't think that one-size government-run healthcare is going to work for 330 million very diverse Americans, that we've got to have a system that works for choice. I was in a meeting recently with the head of a hospital system in South Los Angeles, and she's somebody who, very much would be in conversation with the left on health policy, but she said, if we could just have more control over those federal and state dollars that are coming to our community, we could do a better job of solving the problems of our community than we can now, because we have to jump through all the government hoops, and they don't understand our problems. So I think this really can be something that if we could ever get out of this crazy partisan environment we're in, that people from the right and the left would see you can do a better job of helping people if you have more local control over the money so that people can solve the problems in the way that works for them. The problems in northern Idaho are very different from the problems in midtown Manhattan, but yet they are all operating under the basic same federal rules. We've got to change that.
Grace Marie, a lot more to come in this debate. Thanks very much for your time, as always.
Thanks so much, Greg.
Grace Marie Turner, president of the Galen Institute. I'm Greg Corombos, reporting for Radio America.